Hello and welcome to our special show FYI, or For Your Information. I'm Gargi Rawat. Now this week there's been a lot of talk about a new variant of COVID called Delta Plus. So today on the show we're going to explain what this new variant is and what are the concerns around it, what does it mean for you, and also of course does this mean that we're headed for a third wave of COVID here in India. So what is this new variant? First let's talk about that. The variant called Delta Plus in India was first reported in a Public Health England bulletin on the 11th of June. Now it's a sub-lineage of the Delta variant which was first detected in India and has acquired a spike protein mutation called K417N, which is also found in the Beta variant first identified in South Africa. So it has that mutation in the Delta variant. The worry is that the mutation, coupled with other existing features of the Delta variant, could make it more transmissible. So far, it has been found in 11 countries. And if we talk about India, over 47 cases have been detected in 11 states. In fact, 3 more states today, the new variant was detected in them. So let's now take a look at what's happening around the world if we talk about, Delta Plus variant and also the Delta variant. Now, while cases of Delta Plus variant are currently very few across the world, the impact of the Delta variant is being felt. Israel, in fact, has asked for masks to be worn in indoor public places as the numbers are increasing there. The Delta variant currently accounts for 20% of the US cases, and due to clusters of the Delta variant in Sydney, certain parts are now under lockdown. So that's the situation around the world if we talk about the Delta variant. Well, let's now talk about, to understand more about this new variant and to understand whether it could fuel that third wave that everybody's been warning about for so long. We're now joined by Dr. Julian W. Tang, Associate Professor, Clinical Virologist, Respiratory Sciences, University of Leicester. Dr. Lancelot Pinto, Consultant Pulmonologist and Epidemiologist, Hinduja Hospital. Dr. Om Srivastav, Member of the Maharashtra COVID Task Force. And Dr. Geeta Vani Rayasam, Senior Principal Scientist and Head Science Communication, CSIR. Thank you so much all for joining us on this show. And Dr. Tang, I wanted to start with you. If you could tell us so far, what do we know about this new variant, the Delta Plus, in the UK there?
So at the moment, the numbers are relatively low, but obviously this is a new variant that's just been recently discovered. And don't forget, we can't sample every person in the UK and sequence every positive sample in the UK. So this is almost certainly an underestimate. Now, the makeup of this Delta Plus variant is based on the 617.2 variant, which includes the L452R mutation that we saw in the Californian variant in the US. Also, this interesting 478K mutation that we've seen elsewhere, which may enhance transmissibility to some extent. And the addition of the 417N mutation from the Beta variant, the South African variant, does potentially enhance both transmissibility as well as vaccine escape properties. So if this variant spreads just as well or even better than the current Delta variant is spreading in the UK, then more people will get infected despite having double doses of vaccination, either Pfizer or AstraZeneca.
Right. And Doctor, just to be clear, so far, while we have been talking here about how there are fears it's more infectious, there's talk of how it could affect the lungs more, how it could evade certain treatments like monoclonal antibody. What do we really know? As you said, the numbers so far are too low to really tell for sure.
Well, it's not just the numbers are too low, the sampling is not complete. I mean, we only sample people who come forward for testing, and there could be those who are asymptomatic and not being tested that could be infected as well. On top of that, the numbers that are actually sequenced is also lower than the numbers that are tested that are positive. So again, the sequencing may actually lie some way behind the actual numbers of the Delta and Delta Plus variants that we're seeing. And the UK sequences more viruses than anybody else in the world. So right. If we're behind, can you imagine how far behind the rest of the world might be?
Right. Dr. Srivastav, if I could come to you next, because, it's in Maharashtra that earlier as well, the numbers started going up again. Now we're seeing numbers are going up there and already steps are being taken. There is a certain amount of alarm and already steps are being taken, like you're not going to, do away with many of the restrictions just yet because you're in this wait and watch mode, and cases of the Delta Plus variant have been found there in Maharashtra.
Yeah, so first up, thank you for having me on your show. You're right on both counts. It is indeed that there is a fair amount of aggression in the total amount of testing and the total number of cases that we are seeing in Maharashtra. Whether it is reflective of any one particular step that is being taken, I don't know. And it is much too early to comment upon how extensive is the Delta wave going to be in Maharashtra at this time, at least. This may slow down. This may actually get more aggressive. The numbers may climb, may get worse, and that the total amount of clinical presentation may also change. But again, like I'm saying, it is much too early. We probably need to be very watchful of this variant so far. Amongst the variants that we have already spoken about, there's going to be need to look at the precise genomic sequencing and the changes that come thereof before you say that a particular variant, which is the 417 or the 617 or any of those, are going to be present, and what changes are going to be coming after what we know at this stage. So what you think is the most obvious situation right now could very easily change inside a month's time. I think there is a need to be doing what we have been doing so far with public health and doing that as well as we can, and keeping a very watchful eye on the genomic structure of what this virus is changing. What that means is also is that social distancing and masking and doing all those things that we did to keep the numbers under control in the past, we must continue them and probably keep a very close eye before we are going to come to a conclusion that this is how grievous the Delta variant is or how innocuous it is at this time.
Right, and not repeat the mistakes that we made between, the first and second wave, where at the same time we knew there were variants, but, we didn't seem to be too anxious about them. And then, we had what we did in the second wave. Dr. Geeta, to you now, what do we know about this new variant Delta Plus so far? As I was discussing with Dr. Tang, there are reports that perhaps it could be more infectious, perhaps it could affect your lungs more. What do we know?
Yeah, firstly, thank you for having me here. And as my previous panelist said, it's very early. What we know is at the genetic level. We do not know so much at the clinical level because the cases are rather few. So what we know from the genetic or the RNA level is that there is this mutation, K417N, which is over and above beyond the Delta variant. Now, what is this mutation? What is known is that this mutation has been reported earlier also, not in the Delta background, but in the South Africa variant or the Beta variant we call, and also in some other background. So what we know from those variants is that this particular mutation actually decreases the affinity or the binding to the antibodies. Now, what could be the consequence of decreased binding to the antibodies is there can be immune evasion. Now, you may have developed antibodies because of your vaccine or because of your prior infection, and you assume there is protection. Now, if because of this mutation, if somehow these antibodies are not able to neutralize this virus, that could be a concern. Now, while we know this from the other variants, like the South African variant or the Beta, we still do not have the data with this Delta background. So I think we need to wait for the data in the next few weeks, which we hope we will have data, because immune evasion is, I think, what could be a worrisome factor. We already know that Delta is highly transmissible. We already have that data. So it would not be surprising if this variant is as similar as Delta variant in terms of transmission. At least from the mutation per se, I don't think there is evidence to say it is more transmissible. But again, we have to generate data both in the lab with experiments. I think only then we can conclusively say that there is going to be immune evasion. But at the genetic level, that could be a concern.
Right, and Dr. Geeta, we were talking about how in England they do the most amount of genomic sequencing, the most aggressive. They're the ones who first talked about this Delta Plus variant. But here in India, how has the picture changed on that front? Are we doing more genomic sequencing? Do we need to increase it even more? And we do know that it's something that is quite expensive.
Yeah, so I think today there was a briefing by the Health Ministry, and I think India has ramped up the sequencing, and already there is this consortium of INSACOG. The number of labs doing it has increased now. There are about 28 labs doing it. And also, for example, talking of CSIR, we are already working with Government of Maharashtra and Government of Kerala. In addition to the INSACOG efforts, already routine sequencing is going on in Maharashtra actually, and even in Kerala. So I think there is sequencing going on. Of course, more can be done because more data it is better. But I think nonetheless, the efforts have been ramped up. And I think we need to continue this genomic surveillance along with the other, the measures which we are taking in terms of precautions and all that.
All right, Dr. Pinto, now to you. And, we're talking about all these variants, and all of us, even me, I think I feel I've really learned a lot about it, studied a lot about it in the last couple of months. But for viewers, they're saying we just heard about the Delta variant. Now there's talk of a Delta Plus variant. What would you say to them? Because there's been a lot of apprehension about the third wave as well, and now the emergence of a new variant.
Good evening, Gargi. So I think we are in a better position than we were compared to the past two surges. As has been spoken before, the surveillance in terms of genomic surveillance has improved, which is why we've detected this to begin with. So we are not detecting this as an afterthought after the spread is significant. It still appears to be a really small proportion of individuals, or the small proportion of samples which seem to be positive right now. So there are two things that we need to look at. Number one, how does this spread? And I think the government is on it. The government is keeping a close watch on the index cases that have been reported and seeing what is the extent of spread, looking at whether it's more transmissible. I think an equally important question, and I think that's what really matters to clinicians, for example, is to see, number one, whether the incidence of breakthrough infections increase, so vaccine breakthrough infections. So that's the data we're going to get from hospitals. Not only whether do these infections increase, but do they result in hospitalizations. So far, we've been reassured by the fact that even if you do get infected after vaccination, the incidence of hospitalization and death seems to be really low. With this variant, I think that's one of the things that we need to closely watch, whether do the rates of hospitalizations increase among those who've received vaccines. The second big question for us would be reinfections. Individuals who have been infected in the recent past, over the past 4 to 5 months, what is the incidence of reinfections that occur? And I think the data that has been collected over the past year, I think we have enough information to kind of connect the dots and see if this really happens. And these are the things that we really need to watch out for.
Right, Dr. Tang, your view on that, because there is a worry about vaccines and their effectiveness against COVID as new variants emerge, and now we have the Delta Plus variant emerging. And in Israel, there have been cases of the Delta variant reported there from schools. And while I know that children are not vaccinated just yet in Israel, some of the elders also got it in the schools, and they had all been vaccinated with the Pfizer vaccine. So there is concern about the breakthrough infections.
Yeah, so my colleague earlier has mentioned this. There's a reduction in neutralizing titer with the Delta variant against the current AstraZeneca and Pfizer vaccines, which were raised against the Wuhan virus. So what that means is that as the antibodies start to drop over time, because they always do, you may drop below the level that will offer you protection against the Delta variant and others like the South African variant, for example. And in fact, the South African variant that contains the 417N is, if you like, the worst of the variants for this, because it can reduce the neutralizing titer by 7 to 11-fold, whereas the Lancet paper recently showed that the reduction from the Delta variant is about 6-fold. So you can actually lose less antibody and still be susceptible, and then become susceptible to the South African variant earlier than before the Delta variant. So if you put this together in a Delta Plus variant, you may find that the Delta Plus variant may reduce the neutralizing titer by perhaps 5 to 10-fold, at which you may get more breakthrough infections.
All right, and the need is also now to vaccinate faster. Dr. Srivastav, your views on that, because, so far we have fortunately increased the pace of vaccinations here in India. And of course, the government has said that by December, hopefully we'll vaccinate all the adults. But your view on, because if we don't vaccinate, fast enough or in time, we're going to see new and more mutations taking place.
Yes, absolutely right.
Right, Dr. Srivastav, go ahead. And I'll come back to you, Dr. Tang. Yes.
You're absolutely right, Margie. I think that there is nothing that can take the place of vaccination. We must vaccinate. We must vaccinate with the first dose, and we must vaccinate with the second dose. We are in a situation where the availability of vaccines in our country may not be meeting all our requirements, but in spite of that, we must prepare for vaccinating as many people in the shortest possible time. With we talk about which is the best vaccine. The best vaccine is which is most easily available at your hospital or your primary health center or your doorstep. If you are indeed one of those people who are in the population where vaccination needs to be given to you at your home, whatever is available, please take it, and please take it now, and please take your second dose as well. So I can't see how there can be a plan B for vaccination in a country like ours, in fact, for anywhere else in the world, we must vaccinate as much as we can, as quickly as we can, and with the best vaccine that is available, which is what is available. So yes, I think the role of vaccination cannot be overemphasized, and that it's only after we've done what we have vaccinated with, say, 2/3 of the country, only then we are going to be in a position to say that this is the public health impact of transmissibility or effectiveness or a little bit of both. But not vaccinating would be a grievous mistake, would be a crucial
No,
mistake.
absolutely. And I think hopefully we're all on board on that in terms of the center, states, everybody's, pushing for more vaccinations. But Dr. Pinto, some have predicted the third wave may come by September, while the government has said that they hope to vaccinate all adults by December. So what does that mean now? And also, of course, children, that's very important to, start vaccinating children as soon as we can get our hands on some vaccine, get the approvals for vaccine for children, because then they're also big spreaders when it comes to COVID.
So when it comes to COVID, you're absolutely right. The children do end up being spreaders, but I think the reassuring information that we have from recent zero prevalence surveys is that children seem to have been infected at similar rates as adults. And since a very minuscule proportion of those children ended up in hospital, we can be reassured about the fact that children in themselves will be safe. Of course, they will play a role in transmission, and therefore it's important to get them vaccinated. To your earlier question, in terms of the fact that the vaccination is definitely going to lag behind the pace at which maybe mutants arrive, maybe new variants are seen across the board, I think the basic principles still remain in place that no matter what the mutant is, I think double masking indoors, for example, is still going to protect us. Sanitizing, distancing, I think these principles remain constant no matter what the variant is. So I think it's great to be optimistic about vaccination, and there is no doubt in anybody's mind that vaccination is what's eventually going to turn the tide. But letting our guard down while we are waiting for the population to be vaccinated essentially risks us having the third wave. And I think we should not bank on only vaccination while we are waiting for vaccination. I think it's extremely important to keep the basic scientific measures in place to prevent spread.
But we've all seen the visuals of the last couple of weeks as restrictions are lifted. And Dr. Geeta, your concerns regarding that, because there are reports from Australia as well about the Delta variant, about how, two people just crossed one another and it was just within a few seconds of the crossing, and already one person who was infected managed to infect the second person. So that's very concerning in a very populated and crowded country as ours, if we're going to have such quick transmissibility of the variant.
Yeah, no, I agree with Dr. Pinto's comments, and I think it is definitely a concern because the pandemic has been there for 1.5 years. People are wary. But I think we should not let the guard down, because simply vaccination is the solution, but it's going to take time given the country's size and our vaccine scaling up and the manufacturing process. It's definitely going to take time to populate the entire country, and even 60 to 70% to reach a level where there is detectable protection in the community. So I think mask is the solution, and I think double mask, if you're wearing a cloth mask or an N95, because that's the only thing which is going to work against any variant. And I think today we are talking of Delta Plus. If we don't maintain this social distancing and mask, there may be another variant. I think we will be talking about in another few weeks another new variant, which may be even worse than this, unless we take the social distancing very seriously and the mask. Because I think people are letting down their guard too early on, and I think this is really concern. And I think this is where we all have a role to play, that we need to continue wearing the mask, because vaccination is going to take time, and these viruses are very smart. They keep on evolving and they will continue mutating if we give them an opportunity. I think masking is really, really critical. I think it cannot be but overemphasized again and again.
All right, we'll slip into a short break right now and return to this question about the vaccinations worldwide, and whether, richer countries need to do more about vaccinating those in, the not so well-off countries, because we're not all safe unless everyone is safe. We'll return after this short break. Welcome back. You're watching FYI and we're talking about the new variant that has emerged, Delta Plus, and what it means for us, what it means regarding the third wave in India. And Dr. Tang, I want to ask you about that thought that I left before we slipped into the break about, in some of these countries, like in the US and in some of the countries where they've had very good rates of vaccination, they're already acting as if the pandemic is over and, and relaxing and but at the same time, you have other countries, the poorer countries, where not even 1% of the people have been vaccinated. So isn't there a need now for a push to ensure vaccinations, rates are higher in all these countries? Because as I said earlier, we're not all safe unless everybody is safe, because this pandemic will keep just going round and round.
Yeah, so this is a very political question. I mean, places like the US and UK and other European countries have bought a lot more vaccine than they need to cover their populations. I think the main problem is that the supply chain is relatively slow to roll these vaccines out. But I certainly agree that once all these vaccines start to become available, we should send some of these vaccines overseas to countries that need them a lot more than we do here.
Right. The politics apart, the dangers of it, isn't it? Because the longer this virus keeps circulating in populations, it's going to keep mutating.
Yes, if you look at all the different variants, for example, the Indian, Brazilian, South African, and the UK Kent variant, they all arose during very high levels of replication during those pandemic situations in those countries. So, of course, this is where, and now you see Southeast Asian countries starting to spike with new outbreaks and waves. We may see new Southeast Asian variants appearing, like the Nepalese variant and the Vietnamese variant that we've seen already, acquiring new mutations that may allow further vaccine escape and enhanced transmissibility.
All right, Dr. Pinto, there have also been concerns about, the Covishield vaccine, about the duration between doses and whether we need to, shorten that duration because we need better protection. Just one dose is not enough protection, especially with the emergence of new variants.
I think that's a difficult question when you have limited vaccine supplies, whether you want to try and achieve the entire population having at least one dose, which does offer some degree of protection against hospitalization and severe disease, is what our understanding, versus getting two doses to a subset of your population, while a majority of your population then remains without being vaccinated at all. I think there is a strategy to be thought of where you choose your high-risk individuals and offer them two doses at a shorter duration, and then let the rest of the population wait out for a slightly longer duration. But this will have to be modeled based on the supply of the vaccine, and the best strategy will have to be figured out based on what our supplies are.
And Dr. Srivastav, an urgent need for us to, increase our vaccine kitty. We still only have two vaccines. We have Sputnik as well, but it's not that freely available. So we need to really increase our kitty and vaccinate more people.
Yeah, so look, again, commensurate with the comment that you've just made, those countries which have got a vaccine abundance prepared for that accordingly. They knew what was their target population, and they prepared for that target population accordingly. Those countries which are now finding themselves that they have a lag in the total amount of vaccine jabs that are available probably did not perceive or did not calculate that this was going to be the total requirement. So this disparity is something that needs to be corrected. And like I was saying earlier, while we talk about masking and we talk about social distancing, in a country like ours, I don't see that happening in the same way as it would happen in, say, Australia. Having lived in Australia, having worked in Australia, or having traveled across the world, I don't think that is something that's likely to happen in the most densely populated parts of India. Urgency of the second wave or the third wave or not. So I think that